Welcome back to Nurse's Nook and Corner, where we break down complex medical topics in simple, easy-to-understand videos. Today, we're talking about ECMO, a life-saving technology used in critical care. Let's dive in. Before getting into the topic, kindly like and subscribe our channel. This will motivate ours to engage with more educational videos. Why it is important to know? ECMO is a critical life support technology used in severe cases of respiratory or cardiac failure. As the medical technology is growing faster, its awareness helps us to understand the procedure, provide clarity during stressful time, and better, we can support our loved ones. What is ECMO? ECMO is a life support technique used for patients with severe respiratory or cardiac failure. It functions by temporarily taking over the work of the heart and lungs, allowing these organs to rest and heal. We all question how it works as a heart and lungs. Let's see how ECMO works. ECMO works by these three processes. Firstly, the blood removal. Blood is drawn from the patient's body through a cannula, a thin tube, inserted into a large vein or artery. Secondly, oxygenation. The blood is then passed through an artificial lung, the membrane oxygenator, where it is oxygenated and carbon dioxide is removed. And finally, reinfusion. The oxygen-rich blood is returned to the patient's body, typically through another cannula. When is ECMO used? Doctors use ECMO in cases where both the heart and lungs are too weak to function, like severe heart failure, lung failure, or even during certain surgeries. The primary indications for ECMO include severe respiratory failure, conditions such as acute respiratory distress syndrome, ARDS, severe pneumonia, or other lung diseases that result in inadequate oxygenation or carbon dioxide removal. Cardiac failure, situations where the heart is unable to pump effectively, such as cardiogenic shock, severe heart attacks, or during recovery from cardiac surgery. Cardiac arrest. In cases of refractory cardiac arrest where conventional resuscitation efforts have failed, ECMO can provide temporary support to restore circulation and oxygenation. Bridge to recovery. ECMO can be used as a temporary measure while waiting for recovery of the heart or lungs, or while awaiting a transplant. Severe trauma. In cases of significant trauma that affects the heart or lungs, ECMO can be used to stabilize the patient. There are two main types of ECMO: veno-venous, VV, ECMO, which supports the lungs, and veno-arterial, VA, ECMO, which supports both the heart and lungs. Type 1, VV ECMO, venovenous extracorporeal membrane oxygenation. Purpose: primarily used for patients with severe respiratory failure, such as those with ARDS, acute respiratory distress syndrome, or other conditions that impair oxygenation. Mechanism: blood is drained from a large vein, oxygenated through a membrane oxygenator, and then returned to the venous system. This allows for oxygenation of the blood without supporting cardiac function. Type 2, VAECMO, veno-arterial extracorporeal membrane oxygenation. Purpose: used for patients with both cardiac and respiratory failure, such as those experiencing cardiogenic shock or cardiac arrest. Mechanism: blood is drained from a vein, oxygenated, and then returned to an artery, which provides both oxygenation and circulatory support to the body. In summary, the choice between VV and VA ECMO depends on the specific needs of the patient, particularly whether the primary issue is respiratory or cardiac in nature. How long can a patient be on ECMO? Patients may stay on ECMO for a few days to a few weeks, depending on their condition. The goal is to support the body while recovery treatments are given. Risks and challenges of ECMO. Although ECMO can be life-saving, it comes with risks, including bleeding, infection, and blood clotting. Doctors monitor patients closely to minimize these risks. Here comes our nurse's role in taking care of ECMO patient by using ABCDE approach. When ABCDE approach applied to ECMO, extracorporeal membrane oxygenation patients, it helps ensure comprehensive care. Let's see how each component can be adapted for ECMO patients. Airway. Most patients in ECMO is managed with mechanical ventilation. hence confirm proper placement of the endotracheal tube. However, suctioning may be necessary to clear secretions and maintain airway patency. Breathing. Monitor the effectiveness of oxygenation and ventilation. Check arterial blood gases, ABGs, to evaluate oxygenation, PaO2, and carbon dioxide removal, PaCO2. Circulation. We need to regularly monitor hemodynamic status, including heart rate, blood pressure, and cardiac output. Assess for signs of adequate perfusion, e.g., capillary refill, urine output. Also, it is necessary to manage fluid status and administer medications as needed, including inotropes or vasopressors. It is important to monitor the ECMO circuit for any signs of clotting or malfunction. Disability. Patient's neurological status is assessed with Glasgow Coma Scale, GCS, as well as assess for any signs of neurological deficits or changes in consciousness. Regularly assess for any signs of delirium or agitation with RASS, Richmond Agitation Sedation Scale. However, ensure appropriate sedation and analgesia to provide patient comfort. Exposure. Conduct a thorough physical examination to identify any potential sources of infection, skin integrity issues, or other complications. Also, maintain normothermia and monitor for signs of infection, particularly at cannulation sites. Ensure proper skin care to prevent pressure ulcers, especially in patients who may be immobile. Success stories and recovery with ECMO. Many patients recover from severe conditions thanks to ECMO. With careful monitoring and the right treatment, ECMO gives patients a chance to heal and return to health. Take-home message: ECMO is a complex but crucial life-saving technology that helps buy time for patients in critical condition. If you found this video helpful, don't forget to like, comment, and subscribe for more medical explanations.